So, Honorable, you're welcome.
Thank you, Mr. Chair, and thank you to the committee.
First of all, I will start by congratulating you for His Excellency the President nominating you as now the Minister Designate for Health, Deputy Minister Designate for Health. Thank you.
Thank you, Mr. Chair.
Can you please tell us in a nutshell about yourself, please?
Thank you, Mr. Chair. I would also like to beg your indulgence to read a statement. Mr. Chairman, honorable members of the committee.
Chairman, when was this statement admitted?
I'm telling about myself, but I felt like if I read it, it would be better than if I ad-libbed it.
2 minutes.
Yes,
We
please.
beg you. Can you off your mic, please? Chairman, 2 minutes. I've seen
Honorable nominee.
Nana Ketia is here, so just want 2 minutes.
Honorable nominee. I'm sure you understood the question, and that was to tell us about yourself in a nutshell. And so we are talking about 2-3 minutes here. Please,
Thank
so
you,
go
Mr.
ahead.
Chair. My name is Grace Mame Arabaya Tarba Ayensu-Danquah. I was born in the Royal Palace of Esikado to Mame Abeson, Oba Opinion Abeson, and Mr. J.H. Mensah, both of whom are deceased. I am currently the Member of Parliament for Esikado Ketan constituency, and I'm here as the nominee for the Deputy Minister of Health. I am a medical practitioner. I'm a public health expert. I'm a professor of surgery, and I'm also a humanitarian. Thank you.
Thank you very much. We're going to start with a questioning, and I will give the friend of the committee to start us. Thank you.
Congratulations, Honorable. Please, what key measures will you introduce or strengthen to help reduce maternal and infant deaths in Ghana? Thank you. Thank you, Chair.
Thank you. I'm glad to be here, and I think your question is a very important question, especially when it comes to women's health, especially with maternal and neonatal issues. Madam Committee Member, what I will do first is that I will liaise with my able health minister, see what measures they have put in place as of date, and see how what best I can add. Interestingly, I'm working currently with an NGO called Project Hope. And what Project Hope is doing is working for the Ghana government, or with the Ghana government and the Ghana Health Service, to see how best we can help from the CHIPS compound to community outreaches in terms of what we can do for health infrastructure in the CHIPS, as well as what we can do for community outreach, so we can identify the women who are high risk before they end up in the CHIPS compound and end up with morbidity and mortality. Thank you.
I'll give you a chance if you
Thank you, Chair.
have a second.
Honorable nominee, how do you plan to address the current shortage of doctors, nurses, and midwives across the country, especially in the underserved areas? Thank you.
Thank you. First, I would like to commend our doctors and our nurses in this country for the great job they are doing. And the condition of service sometimes they work in, we have to empathize with them. However, I also appreciate the efforts they have put in and the patriotism they have shown to the country. Madam Community Member, the issue with the shortage of doctors and nurses, I believe, has been already addressed by my able health minister. the last I checked, or on my update with him, I believe about 100,000, 10,000 doctors have already been brought back into the health system. They're still in the process of putting a lot of other nurses and allied health people into the health system. So once I get to the ministry, I will work with him and see how best we can, so that we don't have any backlog of doctors who have not been employed by the government. Lastly, I believe that the ministry is also working on helping the nurses in terms of the nurses' schools to see how best we can do to absorb those who are home on unemployed currently. Thank you.
Thank you, Chair. Honorable nominee, in my constituency, in Suta-Kwamai Biposo, many of my people are refusing to register for the NHIS card recently because they still have to pay at the hospital even after registering. They feel the card has no value. What will you do to address this issue and make the card more beneficial for them? Thank you.
Thank you, Mr. Chair. The issue of people not wanting to register with the NHIS is also to some extent understandable, because I believe that currently in most of our hospitals we are still doing the cash and carry system, which is why I believe that President John Dramani Mahama has started with the Mahama Cares policy, which would be a supplementary insurance for those who think that the NHIS is not enough, so that it's a supplementary. After they max out on the NHIS, they will have some money to support the rest of their health needs. We say 40% or 43% of most mortalities, all disease mortalities in Ghana, is actually due to non-communicable diseases. So I believe that with the health trust, if we are able to support that, those people who are now having to pay in the hospital, I believe that they will now be able to register for the NHIS, so that once they max out on NHIS, the health trust fund comes in, and that would take care of their comprehensive needs. Thank you.
Congratulations once again, and go and shine. Thank you.
Thank you, Mr. Chair.
Thank you very much. I'm now going to go on to honorable members who are here for subject matter, and I'll go to my left and then ask honorable to start us off on subject matter. You have the floor, honorable.
Thank you, Chairman. Congratulations, Madam Nominee, for such a feat. Chairman, I want to find out from the nominee. We have this issue of unemployment in the country. And to narrow it down, we have theming battalion of healthcare professionals who have been trained and graduated. I remember the last administration of Nana Ayensu-Danquah Kufuor.
Please go straight to the question. Please.
I'm coming. The last administration of Nana Ayensu-Danquah Kufuor initiated a set of health infrastructure which, when completed, can absorb majority of these unemployed healthcare professionals. There was even a period where arrangement between the government of Barbados and the government of Ghana were able to export some nurses for job outside the country. May I find out from the nominee what she's going to do to help the minister to address this headache?
Thank you, Mr. Chair. In the last 6 months, approximately 15,000 nurses and midwives have been processed. The managed migration I believe, is what you are discussing. And our current plan, according to the ministry, and also with discussions with my able health minister, is that the government is working towards actually what the countries are looking for is basically nurses that are degree nurses as opposed to the diploma nurses. So we, as the government, is trying to now change the curriculum where most of the diploma nurses are being migrated into a degree nurse program, because 13 countries have asked that they want to share our nurses, but they are all asking for that expert nurse who is basically a degree nurse. So we are working with the nursing institutions and the training institutions to migrate the diploma nurses into a degree program. And then once we are able to do that to meet the criteria of the 13 countries that are looking for the nurses, and also once the country has had enough nurses to for the rest of, especially for the rural areas, then we'll be in a position to now do the managed migration with those countries that have been interested. Thank you.
Honorable Chairman, my second question. Madam Nominee, we recall we have a national health insurance scheme which has been in existence for decades, which has sustained us. Recently this week, Parliament passed the Ghana Medical Trust Fund in such a haste. I want your take on a section of the Ghanaians who think that once we have a scheme which is viable, which has sustained us till now, why wouldn't the government expand the scope of benefit packages so that we have only one scheme for the nation? Why the intention to establish a parallel scheme, or maybe a complementary one, which main source of funding is the national health insurance? Would you agree with a section of Ghanaians who think this way, and give your basis?
Thank you, Mr. Chair. I think that's a very important question. You talked about parallel insurance. What I call the trust fund is not a parallel insurance. Actually, what it is a supplementary insurance. And the reason why I think it's supplementary is really, I'm trying to explain it really in a basic terms. What it is the national health insurance, it's mainly for promotive and preventative health care. So it takes care of all of us at the very basic level. As we stand today, for instance, if somebody has cancer, what the national health insurance will do is only take you up to a certain stage, even before you are, let's say, transferred or you are referred to a higher level of care. So the trust comes in after that person again has maxed out. In other words, they have reached the maximum capacity of national health insurance. The current government knew that those people, once they get there, as you can all, we can all tell as MPs, what happens is they start soliciting. They come to us as MPs. We see them on TV. We see them on radio. We see them soliciting. These are Ghanaians who have chronic medical problems, who have developed complications of that medical problem. Yet they are out there suffering and begging for funds to support their illnesses. Also, by the time most people in general medically end up with complications of chronic diseases, they would have mostly been retired. The retirement money is not enough. And now you have come up with, for instance, kidney failure. You have to go to dialysis 3 times a week. One session of dialysis is about 1,000 Ghana cedis. That's just for the dialysis. You haven't paid for your labs, you haven't paid for transportation, you haven't paid for anything else. It's just a session of dialysis. So in a day, 3 times a week, you're spending over 1,500 Ghana cedis. If you have to go 3 times, that is how much? That is almost 9,000 Ghana cedis just for a week. So the point here is that once they run out of the NHIS, the capacity of the NHIS, then the trust kicks in, because now the trust is taking care of the rest of where the NHIS ends. This is not anything new, actually. We have best practices elsewhere, where countries have supplementary insurance to support people who have maxed out on basic insurance. So it is not parallel. In fact, it is complementary, and it would really help Ghanaians. There are lots of Ghanaians who are waiting for this bill, who have been suffering in silence, who have been begging for money, and I truly believe that this bill is a game changer for our medical system, and I believe Ghanaians are really waiting for it. People are dying today as we speak because they don't have money. Once that bill kicks in, I believe that they will have enough money to support their chronic diseases, and I think it is the next step in our health system, in the next step in our health financing, and the next step in how we're going to keep Ghanaians healthy. Thank you.
Honorable nominee, I know you are capable of answering questions that are posed to you, but would you please keep your answers brief? We appreciate your opinion and your explanation, but please keep your answers brief. This vetting of yours today is about looking at your competence. It's not a vetting for policy making or policy interpretation, but to go and support your minister at the Ministry of Health to execute, the government agenda for the country. So please, in as much as I tell the honorable members asking questions to keep their questions brief, please, you to do same by keeping your answers brief. Thank you. Honorable member, please go ahead.
Chairman, thank you. A follow-up on my second question. Honorable nominee, the immediate past administration saw the need to cushion patients with chronic diseases by expanding the scope of benefit packages under the National Health Insurance. And with this, I mean the condition of sickle cell disease was added to the benefit packages. The issue of 4 commonest childhood cancers were added. And recently, somewhere last year, the issue of dialysis for patients with chronic kidney disease were added. Would you agree with me that if the current government agrees to help patients with chronic diseases, it's only a matter of increasing the package, expanding the package, so that everybody will be catered under the National Health Insurance, rather than establishing a new scheme, a new bureaucratic system that is going to take money from the National Health Insurance Fund?
Thank you, Mr. Chair. I truly believe that, again, that it is supplementary, that this is a fund that Ghanaian needs. I understand what the previous government had done, but I think that this government, what we are doing is more a comprehensive way that Ghanaians will get the health care that is needed. Thank you.
Chairman, anyway, I think she means duplication with her answer.
Honorable, you ask the questions, she answers them. You may not like her answer, but please go ahead and ask your questions. Thank you.
Chairman, thank you. I think I'll end my questions and wish her well.
Thank you, Mr. Chairman.
Yeah, thank you, Mr. Chairman. Madam Nominee, congratulations. I just have one question for you. How will you use your background in medicine and surgery to advise or support your minister in addressing some of the challenges that confront the Ghana health sector? Thank you.
Thank you, Mr. Chair. I believe that I have extensive expertise in the health industry, starting from my teaching, my surgical background, my research background, and everything I have done in the health, in health throughout my lifetime. So I am really glad that, and humbled and privileged that President John Dramani Mahama has nominated me to be the Deputy Health Minister. Once your committee approves, I am ever ready to support my able Minister of Health to help fix the problems in the health system in Ghana. Thank you.
Is there anyone else here for subject matter? Yes, please go ahead, Honorable.
Congratulations for a very well-deserved nomination. The health sector of late was bedeviled with some labor unrest. And then Minister worked hard together with the health committee to try and solve it. And knowing the complexity of the labor force in the health sector, how would you try to help your minister so that we can prevent many more labor unrest in the coming days? Thank you.
Thank you, Mr. Chair. I believe that the minister is already truly interested in this topic. And I mean, with discussions with him and the update I got from the ministry, he's doing a lot to solve this problem. I believe that with the nursing strike, they agreed to give at least some of the concessions to the things they wanted. He has also brought onto board at least about maybe 10,000 physicians, and also about 15,000 nurses and midwives have been processed. We have about 321 pharmacists have also been processed. So this is a topic that I believe is really near and dear to the heart of my able minister. And so I will bring all my expertise to help him so that we can solve this problem, so that Ghanaians get the much needed health care that they deserve. Thank you.
Congratulations once again. I know you would excel. I wish you the very best.
Ask a question, one question.
Thank you, Mr.
Come to you, Honorable.
Thank you, Mr. Chairman. Honorable nominee, congratulations on your nomination by His Excellency the President. Honorable nominee, I know your punctuality in the chamber and your self-compose has brought you this far. I really know you merit this high office. My humble question is, what it took as a woman, an African woman, to complete the highest level of education in America?
Thank you, Mr. Chair. That's a very interesting question. It hasn't been easy. The journey hasn't been easy. It takes a lot of dedication, a lot of study, a lot of giving up on, your personal comforts. It takes a lot. It takes a toll. But I believe that my parents had raised me and wanted me to reach the highest level of educational attainment, and that is exactly what I did. I took advice from my parents, and that is why I'm here today. It hasn't been easy. The journey has been tough, but I also believe that there's opportunity comes for those who are prepared. Thank you.
Okay, Honorable, you can come in now. You have the floor.
Thank you very much, Mr. Chairman. Congratulations, Honorable Nominee, Member of Parliamentary, Isikado. Chairman, I have the Omahene there, my own chief, Nana Vichiao. Mr. Chairman, I want to ask the nominee, when you look at accessibility to healthcare, it's one big challenge when it comes to this country. Efforts have been made to open up access through the operationalization of CHIPS compound and creation of other health centers. If you take the Western region, our major health service delivery is the Ayensu-Danquah Regional Hospital. A lot of work is currently ongoing, but they are at various stages of completion. If you take Ayensu-Danquah out, Takoradi Hospital and Kwesimintin Polyclinic are not having the necessary facilities to provide the needed health care for the region. As the Deputy Minister for Health, if you get the approval of this House, what are you practically going to do to improve health service access in the Western region, particularly improving and ensuring that the various major health infrastructure like Takoradi Hospital, Kwesimintin Hospital, and Ayensu-Danquah get the needed facelift? Thank you very much, Mr. Chairman.
Thank you, Mr. Chair. Incidentally, Honorable Boama is my younger brother, and so he shouldn't have asked me the question. But, Mr. Chair, the question he's asking in terms of access to health care, I believe is one of the biggest problems we have in the country. There's a lot of people in the rural areas that do not have proper access to health care, and that is why the Mahama free primary health care policy, I think, is going to solve that problem. The reason being that we are now focusing on the CHIPS compound and the community. So if we get people to have good health care at the CHIPS compound level, which is both promotive and preventative, we will not get to a stage where people actually get sick and they all end up in Ayensu-Danquah and in the referral hospitals where there's a backlog. So I'm really hoping that once I get the nod from the committee and I go to the ministry, I will work very hard with my minister to see how best we can to really effect the Mahama free primary health care. That is also another policy or another game changer in our health system. If we are able to catch people before they get sick, if we are able to take care of their health before they get the chronic disease, if we are able to manage them before they get complications from the chronic diseases, I truly believe that that would be the health system that Ghanaians have been looking for, and that would prevent a lot of deaths and also morbidity and mortalities. Thank you.
Mr. Chairman, just a quick follow-up. One follow-up. Nominee, the issue when it comes to CHIPS compound is not just the structure, but the facilities therein, the labs and the rest. So what are the plans for the ministry to ensure that we just don't put up the building that we call the CHIPS compound, but we ensure that the necessary facilities that are needed for people to enjoy those healthcare are done? Thank you.
Thank you, Mr. Chair. I truly believe that just building a facility is not healthcare. What we need in the facility are the services that goes along with building the structure, so the infrastructure and the services. President Dramani Mahama has planned to have 600 CHIPS compounds. We also have policies or plans in place to actually equip those CHIPS compound, which is all part of our primary health care, free primary health care system. It will be both promotive and preventative, so that the CHIPS compound will be an entity on its own, not just with the structure, but also with the services that are needed, the proper labs, the proper radiology, which is the x-rays, as well as the services in terms of the staffing, like the midwives and perhaps a trained doctor who will be available at the CHIPS compound. When that happens, we will not have that backlog, as you had mentioned earlier, at places like Ayensu-Danquah and in our referral hospitals. Thank you.
Thank you very much. Honorable members, because this is a health matters or health sector issue. That's why I'm allowing those around the table who are interested in the health sector or the healthcare of Ghana to ask questions. So I'm going to yield the floor to honorable member who will be the last person on friends and basically subject matter areas. Then from there we'll move on to the committee members to start asking questions. So you have the floor, please.
Thank you, Mr. Chairman, for the opportunity, and congratulations, Dr. Professor Grace Ayensu. When you look at the health sector, you have been in the private sector for some time, and you see how most of the private facilities are much more efficient sometimes when it comes to diagnostics and the rest. So the turnaround time in the diagnostics are faster in the private. But when you go to the public hospitals, patients generally complain about diagnostics that they will say, go and come tomorrow, come next tomorrow, go out and do this test and come back. I would want to know from you, what will you advise your minister to do to get these hospitals, public hospitals, equipped with the needed investigation equipment so that the turnaround time would be shorter for patients? Will you advocate for a PPP that would allow for procurement of equipment, placement, and maintenance contract, or you only would like the private sector to provide you money to buy the equipment? I want to know your opinion and how you advise your minister to make our hospitals, investigation, laboratories, imaging, and then the rest very efficient for patients.
Thank you, Mr. Chair. I believe that this matter has to do with health management or healthcare management. I have had the opportunity to manage a hospital in California called the Basto Community Hospital, and it has to do with management. It's not necessarily that the person is a doctor so they can manage a hospital. Health management or hospital management is a whole other field on its own. And I believe that in our public sector, what we don't have is that kind of proper health management. It's a business entity. So we need to get managers who are experts or competent in actually managing hospitals, so that they would know that, you know, when you buy an X-ray machine, for instance, what warranties do you get? Once the 2-year or 1-year warranty wears out, have you bought extended warranty? If you have bought extended warranty, what company did you buy it from? Does the company have in-country people to fix when there's a problem? So who is the one, if there's a problem, will calibrate your machines? Because remember, hospital equipments have to be calibrated. We also have an issue with biomedical engineering, as we don't have enough biomedical engineers in this country. So I know that it's part of the minister's plan to actually have, or in the NDC manifesto, about this biomedical engineering school that would happen, that would be done at the University of Ghana campus, so that we can train biomedical engineers to take care of this problem that you have. When you go to most hospitals, we have something called an equipment graveyard. And that's where all the bad things happen. Some X-ray machine is broken, then all the machines, we've pushed it to some corner. But sometimes you can take one small piece from this machine to fix another machine. So what we don't have is those extended warranties. The companies where we buy it from, do they have experts in country? If they don't, will they bring someone in country to help, or will they even bring someone from the company to train biomedical engineers in Ghana? So I think that once our biomedical school, which was in the NDC manifesto, is done, in the meantime, I have seen that the minister is also working on a lot of programs so that this particular problem that we are talking about will be a thing of the past. Once I'm given the nod, I will go to the ministry and I'll also support him with all my ideas, and then we'll see how best we can help fix that problem that you're discussing. Thank you.
Honorable nominee, I know we've given you the opportunity to demonstrate your competence, your knowledge and background. But please, let's keep the answers short. Just as I have asked honorable members who are asking you the questions to keep it short, please try and keep your answers short as well, so we can get this done before it gets late. Thank you. Next, we are now on the committee members to ask questions, and we'll go to Hajia Ladi to start us off. Thank you.
Thank you, Chairman. Congratulations, my sister.
Thank you.
For me, I want my answers, and I always demand very, very short. Reading your profile and where you are coming from, and what I know, and even heard part from you, the way you are able to work, I want to find out from you. What will you put in place to support women who get fistula after birth? I'm asking this because it's a very big problem, and you know it better. What will you do to support them?
Thank you, Mr. Chair. Female fistula, postpartum fistulas are a very big problem, and it has a lot of stigmatization for women. As we speak, I have already, maybe starting in 2012, I've been bringing doctors to do those procedures. So once I get to the ministry, I will work with my minister to see how best we can get more surgeons to come here to do free fistula repairs. The actual surgical procedure is not that big of a procedure, but it's very technical. So we need experts to come to support us, and once we're here, we can also train other doctors, local doctors, to be able to do those, so that the female fistula will be a thing of the past. Thank you.
My second question has to do with the same issue of fistula. You have just mentioned what you are able to do, bringing in people. But if you observe, you realize that most of the fistula cases do not actually come from those in the urban areas. Mostly it's from our villages, people who even do not have access to health at all, and they don't know what to do to themselves because they don't have the money. What will you do further, if given the nod, to ensure that those in our villages or rural areas, even if it were regional, also benefit from what you have just told us?
Thank you, Mr. Chair. Because of the technicality of that particular procedure, the patients that are going to undergo that procedure have to be brought actually to the urban centers. So what we can do is we can do good public announcements. Every city, every state, if you don't have a town crier, you have a public address system. So we can do maybe every 6 months a public announcement. People will come, and we can bring them to the urban centers so that they can undergo that procedure. They need full anesthesia, and we can't do that in the field. Even if we did mobile services, we won't be able to do it. So we need to find a way of getting them. You know, when people have fistulas, it's easy to identify them in any community because of that stigmatization. So I believe that we can find ways of communicating to the rural areas to bring those people so that we can really work on them. Thank you.
Mr. Chairman, my third question. In the rural areas, although we encourage them to be delivered in the hospitals, but some of them are very far. And so they use the local women. They have a name, maybe you will remind me, but I remember we have women who give the TBS, that is the traditional birth attendants, isn't it, who support them in the villages. But they have been so discouraged because there's no support for them. So some women actually struggle to give birth all by themselves. Some traditional birth attendants also take the risk and go to help those who
are going to be delivered without even gloves. Will you suggest to your minister to take up this particular activity to support the TBAs so that they can work better?
Thank you, Mr. Chair. I believe that issue you're discussing is access to health care and access to proper delivery. And I think all those things will be answered under the free primary health care program. Because at the level of a free primary health care, we can go into the communities and identify those women who are high risk of pregnancy or high risk at delivery. And once we identify them, we can take them up to the district hospitals so that they are removed out of the community and they don't end up with complications. And also, it will also help support the traditional birth attendants. Thank you.
Last but not the least, Mr. Chairman, the lowest level of getting medical attention from you, the professionals, mostly is at the CHIPS. For now, I know very well that most CHIPS compounds are not supposed to be built in just one community. They serve about, say, 4 or 5 communities. Some communities tend to be very far from the CHIPS. That notwithstanding, the CHIPS are just places like an aid, giving aid to patients and referring them. But you observe that some women, children, the elderly, persons with disability, they go there, and because they don't have it, they don't have the funds, they are not able, they don't even want to be referred. And sometimes when you refer them, they wouldn't go because they don't have the funds. In giving birth, I know we need beds, those beds that are used for women to give birth. We also need some few beds for the children, and then maybe for just the short-term admissions. But these items or this equipment is not readily available in our CHIPS. Will you use your office, and for that matter, in consultation with your minister, to use the philanthropic manner, humanitarian way that you have used in assisting, to ensure that some of our CHIPS compounds, if not all, because it can be a gradual process before we get everybody on board or all the CHIPS on board. Can you help so that we begin something to support the rural folk?
Thank you, Mr. Chair. The issue of not enough CHIPS compound, again, it has to do with access. And President John Dramani Mahama has promised that, or my minister has, at least in the last press conference, was that we'll build 600 CHIPS compounds. So those 600 CHIPS compounds will be situated in places where the proximity to the CHIPS compounds will be shorter. And so they will be spaced out through the nation so that it has to do with proximity from the area, from home to the CHIPS compound. Lastly, some of the issue that you are discussing in terms of the facility itself, the services within a CHIPS compound, that will also be addressed under the free primary healthcare. Again, with the free primary healthcare, we want to make sure that when somebody gets to a CHIPS compound, they get all the preventative and promotive health they need. Unless the CHIPS compound is not able to do it, then they will transfer you to a higher level of care. Thank you.
Thank you very much. I wish you all the best and more grease to your elbows.
Thank you very much, Honorable. I would now like to give the floor to Honorable Patrick Boama. Honorable, please, you have the floor.
Thank you very much, Chairman, and congratulations, MP for Esikado-Ketain constituency, Professor Grace Ayensu-Danquah. I take you to page 4 of your CV. Chief Medical Officer, Director, Sage Medical Care, 2021, present. Page 5. Cape Coast University Hospital, 2019 to present. School of Professional Health and Science Global College, Professor Surgery, 2019 present. 2018 University of Utah. Are you still in these employment? Have you appeared before the Committee on Members holding Office of Profit to sign up in accordance with Standing Orders 224 and Article 79 also of the Constitution?
Thank you, Mr. Chair. Almost all these places you have mentioned, I'm working pro bono. I don't get paid. I am still working at Sage Medical Center and I haven't received any remuneration. When I go to Cape Coast University Hospital, I don't get any remuneration. What I do, I'm a global surgeon and a humanitarian. So I go to these hospitals to support in teaching. Currently in Cape Coast Medical Center, we are doing a laparoscopy, which is a minimally invasive surgical training. In September, my team is coming from the US, and we are teaching the people there how to do surgery without big incisions and using the camera to get a 5mm and a 10mm incisions. So most of the work I do in Ghana or in hospitals are work that I do pro bono. I moved back to Ghana so that I can support the health system. And these are some of the things I do to support my country and the good people of Ghana. Thank you.
Very well. We'll be looking into that, whether you've been receiving some transportation allowances or it's possible, is it?
Mr. Chair, I put 10% of my income down to do my humanitarian work. Thank you.
Well, Mr. Chair, then this takes me to my second question. On professional standards, ethics, medical negligence, and what have you, a lot of people have died in this country because of some level of negligence on the part of health professionals. From where you've trained, I've gone through your CV, New York to LA, Beverly Hills, and what you've seen it all. What are some of the steps you'll be taking to assist your minister into improving the standards that you are so used to in the medical field in Ghana, especially now that you are going to be in serious public service?
Thank you, Mr. Chair. The issue with medical negligence is a huge issue, and I think that training, beginning of the medical training, is where we can teach and avoid those problems in the future in terms of when they become full doctors or full nurses. That is why I truly believe that that biomedical school that will be built in Legon or on Legon campus will actually be the solution to that problem. We need to teach them early in terms of the pre-medical teaching. For instance, in the US, the medical education, the first 2 years we do didactics, where we are actually in the lab, we're in the anatomy lab, we're in biochemistry lab. So those are actual basic training. Before we get onto the field, we've had almost 2-3 years of just basic training. And that is what makes the expert a better expert. So I think that as we are revamping the curriculum, especially even in the nursing schools and some of the medical curriculum, once we get to where we are actually doing a better work with the pre-clinical training or the pre-medical training, I think that we will avoid some of these complications that you see. As I am right now, what I do now is really take care of other people's complications. So I know exactly what you're talking about, but it will start with proper training in the beginning. Thank you.
Chairman, thank you. If we leave the professor, she will give us a lecture here today. But My late dad started life in secondary Takoradi area. And it's my second favorite city in the country. I'm always there. Kwesimintim, secondary Takoradi, Saima, those days. But you talk of Efian Kwanta, and it's not like it used to be until the MPP decided to upgrade it. You're smiling. Yesterday, when the minister appeared before the House, it was part of the programs that he was going to complete. He didn't admit that it was started, and it had gotten to a point. Said, today, it's okay. If you live at Intankofo or Kujokrum, now telephone is available. But in the states where you used to live, they've advanced into the areas of telemedicine, which found expression in our manifesto. If you had not won the seat from us, and if we had won, it was part of our manifesto. But grace will not let us win. So it's okay. So telemedicine, I've gone through your manifesto. I didn't find it anywhere. Will you advocate for that? And don't say that it's because of the MPP. It was in the MPP's manifesto. If it's a good policy, it's a good policy. Would you support the introduction of telemedicine backed by law, so that those who live in the rural communities can have access to medical professionals, the doctors, rather than sitting in a car and getting to the hospital and the doctors will say, brought in dead. Dr. Anyasana Mokan, brought in dead. Professor, take your time.
Thank you, Mr. Chair. I think that, again, your question is going to access to healthcare, so that bringing the healthcare to the people is better than people coming up for healthcare. And that is why I believe in the President John Mahama's first term, he started with the mobile clinics, which is Onuado. Because once the mobile clinics get there, you can put the telemedicine inside the mobile clinic. Because remember, the telemedicine
President Mahama is the current president too. That's the second coming of JM. You are talking 2016. I said now. Now, Prof. Ciciara.
The second coming of JM will also continue with the Onuado. Again, it's about access to healthcare. We need to bring the health to the people rather than people coming to look for healthcare. That is what has caused all the backlog. And that is where some of the issues we are discussing. People just don't have enough access to healthcare. And the best way is to bring the health to them. That will be by mobile clinics, mobile hospitals, mobile surgical facilities. So once they get there, you can use those mobile clinics also as your source of telemedicine. Because once you are doing the telemedicine, at some point you still have to see the patient. At some point you still have to treat. So the telemedicine doesn't do everything. The woman in the village doesn't have access to high-speed internet. So it is those mobile clinics that will be equipped with the telemedicine, so that somebody can sit in Kojok and look at an x-ray, and I can send an x-ray to the United States and somebody can read it for me. However, in the final analysis, I have to treat the person in Kojok. I cannot treat them telepathically or on TV or on a screen. So regardless, there has to be some human contact. And that is why a mobile clinic is rather the solution than just telemedicine. Thank you.
Chairman, with a nominee who has politics as part of her hobbies, she will play politics around the table. It's okay. It's okay. Congratulations, Professor.
Thank you, Mr. Chair.
Thank you, Honorable. I will now turn to Honorable Akurugu. You have the floor.
Thank you, Mr. Chair. Congratulations, my sister. Yes, we have shortage of health workers in the country. when you look at the statistics, those who are not able to afford medical care, most of them go to the public hospitals. And when you go, in the morning you see a long queue. Per ratio, one doctor, probably about 50 or sometimes 70. And then because of exhaustion from the doctor, he gets exhausted because of the number of people. Most of them are not able to be attended to. What are you going to do? Because on my desk right now as we speak, we have a lot of doctors, nurses who have completed school and are seeking for employment. What are you going to bring to the ministry to help cap this menace? Thank you.
Thank you, Mr. Chair. I believe this matter is near and dear to the heart of the health minister. Since the last 6 months, about 15,000 nurses and midwives have been processed. He has processed about 10,000 doctors, and he's trying to process all the backlog of doctors and nurses that are home to bring them into the health system. And once that happens, the health disparities in terms of patient-doctor ratios will lessen. Even though we do have rural and urban disparities, I think that once we have absorbed all those who are home, some of these disparities will lessen. And then once we are there, we train more doctors and nurses, and then we absorb them. So efforts have been put in place to address those issues. And once I get to the ministry, I will support my minister to make sure that these efforts are expedited as you wanted. Thank you.
My second question. I hear you did not do science in Ghana. How true is that?
Thank you, Mr. Chair. Yes, in sixth form, I did history, English literature, and religion. When you go to the United States, you have an opportunity in your first degree to go any path you want, and I chose to do biochemistry and specifically biology for my first degree. Thank you.
Mr. Chair, no further questions. I'm wishing you all the best. I know you are capable of making us proud. Thank you.
Honorable Ma, you have just arrived, but you have the floor.
Thank you, Chairman. We have the women. Yes, Prof. We have the women. Thank you. Congratulations.
Go straight to your question.
Okay. Prof, I know Honorable Patrick Boama asked similar question. But my question has to do with medical malpractice. Would medical malpractice insurance reduce negligence in Ghana? Thank you.
Thank you, Mr. Chair. I think that, as you mentioned, Honorable Patrick had asked the same question. And to decrease the incidence or the prevalence of medical malpractice will have to be with better training or improved training. Now, once the malpractice happens, in places like in the United States, it's a very litigious society. So every doctor has to have a malpractice insurance. And the malpractice insurance actually is prohibitory. It makes some of us, we pay too much, so that the doctors are stressed under the malpractice. So I don't think that is the best practice. I think that once we've trained the doctors enough, and especially with the basic sciences and the basics of medicine, the malpractice cases would decrease. And also the doctors themselves or ourselves have to also do some peer evaluations and peer monitoring. That way we can anticipate the malpractice or the complication before it happens. And when it happens is how you treat the complications. It's not necessarily malpractice. We are able to anticipate it and fix it before it gets worse. Thank you.
Thank you, Prof. But don't you think that when somebody, if there is a punishment for failure to honor or to do something right, it will keep the doctors in check than giving them a blank check?
Thank you, Mr. Chair. Not necessarily. In the U.S., my malpractice insurance is higher than any money I have ever paid in my life, but it still doesn't prevent doctors from making mistakes or having malpractice cases. So I think that the solution, rather than punishing or putting a punitive problem or punitive way of fixing the problem, I think that would rather be proper training and also identifying the complication before it becomes a complication and how well you fix it. There's a saying that the sign of a good doctor is when you know there's a complication and how you can anticipate it and fix it. That's what makes a good doctor a good doctor. Thank you.
Very well. I have my second question has to do with ambulance system.
You are on your third question.
Okay, third question. The other one was a follow-up.
Well, you didn't say so.
Chairman.
Please go ahead.
Okay. Chairman says third question. My third question has to do with ambulance. As a rural MP, ambulance system or lack of ambulance is draining our pockets. And sometimes we have to use our party vans to cart patients to hospitals. In recent past, when even one ambulance, one constituency, most of the ambulances, about 70 to 90%, are sitting on blocks. And my question is, and they are not sitting on blocks because they are not proper, but because of the funding system. And so my question is, will you consider NHI absorbing ambulance and emergency system?
Thank you, Mr. Chair. I believe that emergency services are very important, and it's one of the I believe one of the systems that we haven't really gotten right. But I also know that my minister is really working on part of the free primary healthcare is retooling the ambulance service, getting more ambulance personnel, and then training them better, and also even bringing more ambulances on board. And I believe that once that is done, it will solve some of these problems with the ambulance service. I don't necessarily agree that the NHIS should also take over the ambulance service. Thank you.
Prof, the follow-up on the ambulance, I'm not talking about the number, but the funding system. Even if they give us Hampton numbers and we don't have a cost recovery for the ambulance system, it will continue to be so.
Thank you, Mr. Chair. I will liaise with my minister, my sector minister, and see what other plans they have for the ambulance service. But my opinion was what I had expressed in the beginning. Thank you.
I wish you well.
Thank you very much, Honorable. Honorable Jerry, you now have the floor.
Thank you very much, Honorable Chair. Prof, I've just perused. First of all, I want to congratulate you on your nomination, and I'm hopeful that you are going to do very well. I'm not too sure if that is your special aide sitting, or he says your manager. Very well. Prof, please, I've perused your CV. Kindly look at page 9. And I'm very sure you drafted a CV, so just want to run you through a few things. Are you there? So under Community Health Department, please read what is there.
Sorry, Community Health Department. The National Service Personnel, Community Health Care assist 1-year national service work to promote health care in the rural areas of Ghana.
And I said so still under national service, 1986 to 1987 in Accra, Ghana. National service personnel. Do you mean personnel or person? National service personnel or national service person?
I believe it's a typo. That's where I did my national service, right here in Job 600.
I don't know if you got my question. You said national service personnel. So my question is it national service person or national service personnel?
Thank you, Mr. Chair. I'm not sure what the difference is, but all it's trying to say is that I did my national service here in Job 600 at the National Service Secretariat, which was on the 9th floor in Job 600. Thank you.
Okay, so national service personnel. Chama, she said she doesn't know what the difference is. So I'm allowed. Oh, very well.
Honorable, national service personnel is what she was. That is my. This is English language, so we may differ. It's national service personnel is what she was, but if you want to ask another question or she wants to answer, she's allowed to do so.
Chairman, I was thinking that it should be national service person, but if you're thinking differently, I'm guided. Let me go on with my question. So my first question, do you have an idea how many teaching hospitals we have in Ghana?
I believe we have about 10 regional hospitals, and not all of them are teaching, but maybe somewhere around 6 to 10. Thank you.
I think my question was specific, so I've heard you talk about the new medical fund that is being considered. That's on the floor, which has been considered. You know the long title?
I think it's a trust fund, but I don't remember the full name because I popularly call it the Mahama case.
That is the more reason why I asked you that, because there is nothing like that. So I was hoping you give us the long title, which you should know. Prof, I wish you well. I have no further questions.
It is the Ghana Medical Trust Fund.
Honorable, thank you. Thank you very much. And I will now want to turn to, I'm not sure, Honorable Patricia PJ is, are you ready, Madam? Yes, please, you have the floor.
Thank you. Mr. Chairman, I would like to yield to the leader. Yes. I think, and take this opportunity.
You are yielding to is on his way out.
He's coming out. So I would like to wish the honorable nominee very well. Thank you very much.
Very well. Then I will give the floor to the minority leader. Minority leader, you have the floor.
Honorable nominee, you are 6 months in Parliament after swearing in, correct?
That is correct.
What has been your very high moments on the floor of the House?
Thank you, Mr. Chair. My high moments of being in the floor has been the process in which bills are passed. I'm very interested and I find that intriguing. Thank you.
What are your very low moments on the floor?
Thank you, Mr. Chair. Currently, I don't have any low moments.
Have you had an occasion on the floor of the House where any member, particularly from the minority, has acted in a manner that you felt intimidated, disrespected?
Thank you, Mr. Chair. Currently, I don't recall. Thank you.
Honorable nominee, have you had an occasion on the floor in your short period in Parliament where an action by any member in the minority has caused you any discomfort?
Thank you, Mr. Chair. Like I said, I didn't recall. I don't recall.
Honorable nominee, have you had a cause to complain to your leadership in respect of any conduct against your person on the floor of the House?
Thank you, Mr. Chair. Not that I can recall.
Honorable member, your short stay in Parliament, have you had a cause to complain to either the Speaker or his deputies regarding the conduct of any member in the minority against your person that you feel so affected?
Thank you, Mr. Chair. Again, I believe you are asking the same question. I truly do not recall.
Honorable member, in your short stay in Parliament, have you come across any intimidating character whose character has had adverse effects on your person as a parliamentarian?
Thank you, Mr. Chair. I seriously do not recall.
You've been handed a document, a paper. I want us to do some verification exercise on that document. First, identify the document. It has your picture and your name. Is this from you? Is this a verified page, a social media page of yours, please?
Thank you, Mr. Chair. I cannot tell on a piece of paper whether it's a verified page or not. Thank you.
Honorable nominee, please read aloud the content of what you have before you.
Thank you, Mr. Chair.
From the name and everything that is there.
Again, thank you. Again, I do not believe, I can't tell from a piece of paper if it's a verified account.
Not ask the question, I'm saying read. I've shared with you.
Professor Dr. Grace Ayensu-Danquah.
Yeah.
I extend my gratitude to the Speaker of Parliament for addressing the minority leaders' unwarranted attack on me during the parliamentary session last week. #women at work, #the next Isikado Ketan.
Is this coming from you?
Again, Mr. Speaker, I cannot verify from a piece of paper. My Facebook account is meta verified, and this does not have any meta verification. Thank you.
My question is that whether you wrote this.
Again, Mr. Chair, I cannot verify a piece of paper. My Facebook account is Meta verified. There's no Meta verification on this page. Thank you.
Yes, Honorable Nominee, yes, I appreciate the fact that you've been sincere to say that this is not a verified page of yours. But I'm asking you, because you and I are involved in a perception-driven enterprise as politicians, and this bears your name. I'm asking you, since you don't recall and it's not verified, have you written a thing like this, please?
Thank you, Mr. Chair. Again, you're giving me a piece of paper that is not verified, and respectfully, as a lawyer, I believe you know about evidence. There is no evidence here that I wrote it. There are a lot of fake accounts in my name. Again, my Facebook account is Meta verified. This piece of paper has no Meta verification, so I cannot tell you whether this is my account or is not my account. Thank you.
Honorable Nominee, that's fair enough. Man, a copy. Yes, give it. Okay, sure. Give it to him.
Okay, please. Yeah.
My respected colleague, you gave us a 14-page CV. I claim your attention. You ready? You ready?
Wide-eyed and bushy-tailed.
You give us a 14-page CV. You sign against each page to confirm that this is coming from you. Clarify for me, when people address you doctor, people also address you professor, share with us which of these titles match your rank.
Thank you. Both do. I am a professor of surgery at the University of Utah in the United States. Thank you.
Now, there may be jurisdictional interpretations. So I would want you to have this opportunity to clarify for the general public to understand and appreciate where you're coming from. In Ghana, for instance, in the academia, someone may just have his PhD and lectures at the university, but will not be called a professor. You would have to do some publications, then you become an Prof, and then from there you become a full professor. Share with us the jurisdiction where you earn the title professor. How does it come by?
I have defended 2 theses. I have written so many publications, too numerous to count. And I have done a lot of research, too numerous to count. So if I may indulge you respectfully, where do you want me to start?
So, just very simply, have you been conferred with that title, which is a postdoctoral title, professor? Do you have a document from a certified body confirming same to you? Same that you've been conferred with that, just as is done in the Ghanaian jurisdiction, or is different from where you're coming from, please?
Thank you, Mr. Chair. The American system is completely different from the Ghana system. I am a professor of surgery. I have been teaching surgery for at least the last 15 years. Surgery is a skill. So we teach in the theater. We don't teach only in the classroom. As we're doing classroom work, we are also doing teaching in the theater. I am a full professor of surgery at the University of Utah and a professor of global surgery. Thank you.
So that's a very fair explanation. But I want to know from you, so how then does the person earn it? At what point do you then hold the title? Yes, you lecture. Yes, you do surgery. But at what point, once you get in there, do you automatically carry the title, or it has to be conferred in one way or the other by rank? That's the clarification I want you to provide, please.
I am a professor of surgery at the University of Utah. I am a professor of global surgery per the American College of Surgeons and the American Board of Surgery. I have worked in teaching for the last 15 years. Thank you.
So the American College of Surgery, in its role, has your name there as Professor Ayensu-Danquah, correct?
American College of Surgeons has my name as a Professor Ayensu-Danquah. I am a board-certified surgeon, doubly boarded from the United States of America. Thank you.
Very well. Now, may I know from you, in an earlier answer when dealing with a question from one of our colleagues, you said that you practice in Ghana, correct?
That is correct.
Now, clarify this for me. In Ghana, I know that when people are qualified from other jurisdictions and they come, they are required to do something. I don't know whether it's examination or some interview, it's some process of accreditation. And they then get recognized and allowed to practice medicine in Ghana. Share with us your own experience.
Thank you, Mr. Chair. I am fully licensed in Ghana, not only as a surgeon, but also as a surgeon specialist. In 2014, I came to Ghana. Even though I was a professor of surgery in the United States, I came back to Ghana. I took a written exam for a whole day. The next day, I sat in front of 3 surgeons in Kolebu, and I did an oral exam. After the oral exam, I spent another full day doing an ethics class. My license in Ghana is license number MDCRN7629. It was conferred on me on 27 January 2014. That is just a generalist. And I also have my specialist license, both of which were conferred on me on 27 January 2014. Currently, my dues are all paid, and I'm a full member of the Ghana Medical and Dental Council. Thank you.
Correct. Now, in appearing before us, can you share with us whether you have paid your taxes or making arrangement to pay them?
Please, I have a GRA clearance, so my taxes have been paid. Thank you.
Which one? Honorable nominee, in Ghana, how many companies have you registered in your name? Or how many companies are you a director of?
I don't recall the exact amount, but most of them are charity organizations. I believe I'm a part of Healing Hands organization, which is a charity organization. I'm also a part of Esikado Ketan Food Bank, which is also a charity organization that gives out free food, uncooked food, to the poor and the needy. Healing Hands organization, we bring surgeons from outside the country to do free surgical care. We provide free medical equipment to people who need it, especially the disabled. And we also go to hospitals and we do teaching. Specifically for me, I teach people in rural areas how to do surgery. Basically the physician assistants as well as the doctors. I have been to several regions in the country to do my free work. I've been to the Volta region.
Honorable member. Honorable member.
I've been to Eastern region.
Bear with me. Hold on a second.
Do you want to hear my answer?
Please, hold on a second. You see, you remember Vice Chair on 2 occasions entreated you to be brief. The question was on companies. For me, once you answer that you are a director of a company limited by guarantee, we stay there. That was for 30 seconds so that we can make some progress. You get my point?
Loud and clear.
Very well. So that, because the Nananum behind you want to go, so we don't keep them here. Yeah? Now, you've said that companies limited by guarantees. What about limited liability company, profit-making establishment? Are you a director of any profit-making enterprise in Ghana?
I believe I'm a director of Sage Medical Center that is profit-making, but I personally don't get any remuneration from there. And then finally, I believe as of last month, one of my partners registered for the Gold Board, the company, but we haven't started business yet.
Forgive me, you have a different accent from, I'm trying to understand it. Repeat the last.
I said I believe that recently one of my partners registered a Gold Board company, but we haven't started any business yet.
Okay, so clarify, the Sage, let's stay a bit on Sage. You said you are a partner there, it's a profit-making company, correct?
Correct.
How long has it been in existence, please?
Maybe since 2021 or 2022.
And is that where you do the dialysis?
That is correct.
And is it your case that that company since 2021 has declared no profit?
Thank you, Mr. Chair. I don't know the company's finances because I'm personally not making any money out of there, not even 1 peso. The reason why we set up a dialysis company was that we found the need that Ghanaians needed dialysis, and that was a niche that I wanted to fill for Ghanaians. So I personally did it. I mean, I'm doing it as a charity work. I've never gotten any remuneration from the company. Thank you.
So, in other words, no taxes are paid on your behalf as a director? No director's fees, nothing?
No.
Very well. Now, Honorable nominee, please, I handed you a document. First of all, I relate to your background, and I will explain it this way. I was an art student going into BCom, and I was struggling, so I had to abandon it and go and do law, which was my passion. Would you say that getting into medicine getting into medicine was really your passion, considering your background in O-level and A-level?
Yes, it is truly my passion.
Now, the document that I've given you, look at page 2. If you look at page 2, paragraph 4, soon after your results, your FIJAI records has it that you, in those days, you were inconsiderate and disrespectful. Would you say you have outlived this and been a greater person in accommodating?
Thank you, Mr. Chair. I beg to differ. In fact, I'm a very respectful, composed, intelligent woman. Thank you.
Very well. That's why I gave it to you. That it's not from me. It's the document from your own school, FIJAI, secondary school. It's not me. So if you disagree with them, that is what they wrote.
Mr. Chair,
that's what they wrote to us.
For the record, I never went to FIJAI secondary
Sorry,
school.
Archbishop Porter Girls Secondary School at FIJAI. That is what the document you have before you says. Archbishop Porter Girls, FIJAI. It's not, that's why I give you a copy, so that we are fair. The essence of this is not to spring surprises, just to share with you.
Thank you, Mr. Chair. I beg to differ. In fact, in Archbishop Porter's, I was the entertainment prefect. I rose up to be a prefect in the school. And I don't believe that if somebody is disrespectful and inconsiderate, as you have put on the paper, would be rise to be a prefect in a school in Ghana.
Honorable nominee, in context, I am not the one producing the document. What you have with you, you know the source. So this is from authorized sources, not me. So I just want you to get that clarity. Now let us go into the issue of your ministry. We on this, hold on.
Thank you very much. Leader, what you are talking from, the document you are talking from, is a confidential document. And respectfully, I don't have a problem lifting from it to be your position, but it's a confidential report. You are a lawyer, and you know what that means. So, please.
Thank you, Mr. Chair. I would like to again repeat that I'm a very, very respectful, composed, intelligent, hardworking woman.
Nominee.
So this document
Nominee,
is
please, can you
incorrect. Thank you.
Can you hold on? I think you have said that already. So that's clear.
Chairman, you see, I want us to have a very, very smooth voting. The nominee sitting in front of us is our colleague. And my duty is to be fair. I did not press on certain things. When the letter to the National Intelligence Bureau, I am not the one who wrote it. It was written by the clerk on the instructions of the chair of the committee. And I reckon that we received it as a confidential information about you. And it is the reason why I shared with you that take a copy and respond so that you will be able to put things in proper perspective, it is to help you. But if you pick it from the angle that it is the ranking minority leader who is asking you, no, this is coming from the states. So I wanted you to have an opportunity to respond. You've responded, so we can move on. Chairman, can we move on?
Let's make progress.
Yes, sure.
Let's make progress.
Honorable nominee, let me take you to your ministry. The aim at this point is to examine your preparedness to serve the Ghanaian people in this very critical role. Our health sector faces significant challenges, and your nomination comes amidst proposals for new health initiatives alongside the existing framework. Where you have evidence, you can readily support with your answer. That said, I shall proceed. 1. In moments of public health crisis, experts
Hello and welcome back from Parliament, where the vetting of the Health Minister designate, who also doubles as the MP for Esikado Ketan, Dr. Grace Ayensu-Danquah, was taking place. Now, the nominee gave the strongest indication that she would leverage her vast experience in the health sector to complement the efforts of the Health Minister in order to solve the challenges in Ghana's health sector. Many thanks for staying tuned to Channel 1 TV. Do stay tuned for the rest of our programs. My name is Nashika Caesar.
Every journey begins with a single step. Not always easy, not always certain, but always yours. In every heartbeat there's a story of struggle, of courage,